I am Dr. Brian Wood. I am a geriatric psychiatrist. I specialize in treating patients with memory disorders and other forms of cognitive disorders. So I am practicing currently at the LewisGale Medical Center in Salem, Virginia. From a personal standpoint, I'm an osteopathic physician, so I went to an osteopathic medical school, and I think that that is, from a training standpoint, that's something that osteopathic medicine really encourages, is holistic medicine and integrated medicine. So I've certainly practiced that clinically. I think that medicine in general is going in that direction, and I think that in many ways the people who have been doing that are now ahead of the curve. I believe that that's often what's missing in medicine today, is integration and personal relationship with patients. The longer that I'm in medicine, the more I realize that it's impossible to do a good job without that. Particularly in dementia care of people with memory disorders, I'm typically treating them and their families. From a clinical standpoint of what I do, I think I'm very oriented toward that kind of care. I think that's often what people lack. People with memory disorders, elderly people in general, because of the number of medical issues that they have and the number of doctors that they go to. That is I think, even more important in rural areas, where there's less density of practitioners, lower density of patients as well. I think that culturally people are oriented very differently. The groups, the family groups, their cultural groups, the groups that they identify with. And it's important for us as physicians to make that a part of their care. To me, that's patient-centered care, is when we can incorporate that person, understand what groups they identify, and understand what's important to them, and integrate that into their care successfully. That's patient-centered care. I became interested in geriatric psychiatry actually very early on. I was always the one that would volunteer to go to the nursing home because I enjoyed it. Part of that, it comes from my own background of being very close to my grandparents and growing up with them and enjoying, their company. In terms of the pathology, that's absolutely fascinating to me, to know what happens, how the brain modulates and creates behavior, and both functional behavior and sometimes dysfunctional behavior. But the link between what's going on in the brain and how that gets expressed as behavior is really, I think, what we're all about as psychiatrists. And so understanding that piece in terms of geriatric patients is an integral thing to what I do. And how I look at patient care. Many of the trainees and medical students and people that aren't oriented that way will say, how do you do that? Isn't it frustrating, and isn't it sad to work with people that aren't going to get any better? And I've always said that to me it's the opposite, because it's so rewarding that you can do little things. Just the tiniest thing that you do with them reaps so many benefits with them, working with families. It's super rewarding to do that with that population. I've never felt like that it was frustrating, or that it was hopeless. I think just the opposite. And I think that's part of the understanding that you have of the population that you want to work with. That's why I encourage people to find that, in whatever population. For some people, that's children. I understand that. Not everybody can be a geriatric psychiatrist. If they were, I wouldn't have business. But I think that's part of that just having a passion for working with that group. Every patient's at a different place, and that's one of the things that you have to learn to do is understand where they are and how to work with them. Families can be so appreciative of little things that you do. So I think it's very, very rewarding.